Hi, my name is Kayla John. I'm going to be talking about hospice and palliative care and nursing. Just a brief reminder of how a person gets put into hospice care. The doctor states that that person has 6 months or less to live. This next part I was not really planning on putting into my presentation until I found something interesting. To pay for hospice, you can do Part A Medicare, Medicaid, or private insurance. With the Medicare and Medicaid, they pay for 95 to 100% of the costs. Now here's a little interesting tidbit I found. Found somewhere that the highest copay was $5. So I thought, that's kind of interesting. Didn't know that. Thought I'd share. So now we get into the meat of the matter. What is a hospice nurse? A hospice nurse is a registered nurse who provides support for that patient who has 6 months or less to live, along with providing patient support, which lots of times includes pain management. I think that's a lot of what people think hospice nurses are. It's a lot more than that, but still a very substantial part of it. So, sorry, I got off on a tangent. Along with supporting the patient, you're also supporting the family. Also another very big part of it. I know I'm a hospital nurse. I know I provide support to my patients and my family, but with hospice, it gets a little more in depth. So, when I was trying to research scope of practice for a hospice nurse, came across a very interesting article. Apparently, there have been a number of nurses who have been kind of tempted to help a person along into death. They gave them extra medication or treatments that that person didn't really need, or, not at the time needed, but basically they were just kind of trying to ease that person along into death. So, with having said that, a big part of it, we're still a registered nurse. We still have a lot of the same other responsibilities as any other registered nurse does. We are still have lots of ethical considerations. We're still responsible to our board of nursing. You're still responsible to yourself. So, how do you become a hospice nurse? Like I said, it's a registered nurse, so you have either your associate's or bachelor's degree. Then you pass your NCLEX, your state boards. Yay, we passed. Then, after 2 years in a hospice-related field, you can take your certification exam. Certification is CHPN. It stands for Certified Hospice and Palliative Licensed Nurse. I know we all like those shiny credentials behind our names, so thought I'd mention that because that was kind of interesting. Never really thought about credentials for a hospice nurse, but there actually is, and there's different levels of that. There's even some nurse practitioners that have a little specialty. So, keeping in mind certifications, also got to remember you're part of a team. Nursing, team sport includes hospice nursing. You're working with the physicians who are actually, making those orders for that patient, the medications, the treatments, etc. You're working with social workers. You're working with chaplains. I know as a hospital nurse, I love our chaplains. If you're a hospital nurse, you probably love your chaplain as much as I do. Chaplains are very, very important to patient and family spiritual support. Also, another interesting thing that I found, never really thought about this with hospice nursing, but it kind of makes sense. Research teams. Field of medicine is always growing. That includes the nursing field. So why not have specialty nursing research teams for every field of nursing, including hospice? So I thought that was kind of cool. Just because you're a hospice nurse doesn't mean you're a bedside nurse. You can still do your research if, being there with the patient isn't really what you want or need. So, talking more about what you do as a hospice nurse. So, like I mentioned earlier, very big on the pain medication. Don't want to go overboard, but you do have to be very good at your assessment skills. We all learned our assessment skills in nursing. So, with hospice patients, you gotta think, sometimes these patients aren't able to say that, hey, I'm in 10 out of 10 pain and this is where it is. You got to think about all your different scales. You got to think about the flax scale, the FACES scale. You just kind of have to be able to observe that your patient might actually be in pain. So, like I said, probably be very, very aggressive for that pain medication. You also usually have to be good at counseling. Like I said, this patient is the end of their life. It's hard for the patient, it's hard for the family, it's hard for their loved ones. It's a very hard time for everyone, so you gotta be good at being able to talk to these people, being able to try to make them feel better. I know not a lot will make them feel better, but you can at least try to make it easier. Even that can go a long way in helping somebody. So, along those same lines, you have to be very aware of cultural and spiritual practices. Not everyone has the same religious beliefs that you do. Not everybody comes from the same cultural backgrounds. So you got to be aware of what this person and what their family is all about. You got to know what speaks to them, what do they want. So, like I mentioned earlier, your chaplain and your social workers, probably your new best friends. You have to be very, very compassionate. Obviously, I know as nurses we are all compassionate, or we should be. With these people, compassion can go a long, long way. You have to be calm in a crisis. You may not think hospice nursing, ooh, critical situation, but these patients are in the stages of dying. I mean, you got to be able to see that, oh no, this person is going downhill. This person's vitals are plummeting. You got to be able to see these situations, know what to do. I mean, keep in mind hospice, and if they're palliative care, comfort measures only. But you got to be able to see these situations, be able to react in a calm way and not freak out. So, with hospice nursing, patient education and advocacy. Big thing. I know we're always very big on patient education. With patient education, sometimes it might not be really able to do. Sometimes this person might be past the point of understanding what you're trying to tell them. But you should still be able to talk to the patient's family about what's going on, what you're doing, and why you're doing it. Another thing, you have to be very aware of what equipment and how to use it. Any oxygen equipment, IV pumps, feeding pumps, anything like that, you got to be able to know how to use, how to put together, maybe not put together, but you know the necessary parts that you need for that equipment. Okay, so now I'm just going to talk about kind of the interesting things I discovered while I was doing my research, other than the things I've already talked about, like the insurance. In the United States, remember those shiny credentials I talked about earlier, the certified nurses for hospice? There are 11,774 total certified hospice nurses in the United States. 725 of those are in Florida. That's really not a lot when you think about how many nurses there are all over. Another thing that makes hospice nurse unique, it's more hands-on. You are with that patient and with their family. You get to know them more on a personal basis than even us in the hospital. So that's kind of something interesting. Now, like I said earlier, you have to be very, very compassionate. So, it's always been said that it takes a special person to be a nurse. After doing this research and even just general knowledge, and I started in a nursing home, so I kind of got a brief idea of hospice nursing. I think it takes a special kind of nurse to be a hospice nurse. So, did find a couple of organizations that could help out if you're interested in hospice nursing. If you have a family member that needs hospice, there's definitely a lot of organizations that you can look into, like the National Hospice and Palliative Care Organization. If you're a nurse, you can look at the Hospice and Palliative Care Nurses Association. So, with that being said, I hope you enjoyed. I hope you learned. I know I did. And have a good day. Talk to you guys later.